At 1 o'clock, and we have a quorum, which is excellent. And I'd like to add a round of introductions for the Board of Health members, since we have Commissioner Payne with us today. Welcome, welcome. So I would love if the Board of Health members, if you're on camera, could turn on your camera, please, so we could all get eyes on faces to names. And I'm a fan of just, if you want to even just share a little bit about who you are and where you work, or your background, or, your role, whatever you want to share. I think it's great to know who we're working together with. So I will start. My name is Bree McLaurin. I'm the chair of the Board of Health and just really started my term. This is as the chair, as my second term. A lifetime ago, I worked at the health department as a public health nurse and lactation consultant, and then ran Healthy Mothers, Healthy Babies, a nonprofit for 6 years. And I've been a realtor now for about a year. So that's me. Would you like to go next, Commissioner Payne?
I'm Candace Payne. I've been a commissioner for 13 months now, and I've learned a lot. But before that, I was a lawyer in general practice for Luxon and Murphy for about 25 years. So I have sort of a bizarre scattering of knowledge, nothing to do with divorce or criminal. I didn't do any of that stuff. I did a lot of business stuff. So,
and water.
And water, particularly, yes, which is why they put me on the meeting we were on last night. And we had one of our municipal representatives who did not show up, and I understand she has not shown up in the past, and that's the one from East Helena. So I'm hoping we can talk to, there he is, Kelly Harris.
Great, thank you so much. We'll just finish the ones in the room, and then we'll switch to Zoom introductions.
I'm Justin Mergel. This is my second term, I believe, right? On the Board of Health. When I started the Board of Health, I was with Pacific Source Health Plans as the network director. Prior to that, I spent 15 years at Intermountain Children's Home as chief operations officer, as well as chief business officer. And I have been in my current CEO role at Peerview for 11 months. I still know where some doors and keys are, so that's good.
Thank you.
Hi, Mikael Bedell, family physician. That makes me the physician representative on the board. I believe this is the start of my second term. Yeah. Been in practice. This is my 26th year in family medicine. Started out very broad spectrum, working at critical access hospitals for the first 19 years, I guess, and then have been here in Helena, going on my seventh year doing all outpatient family medicine. So as someone who's in family medicine, public health is always near and dear. So happy to be here.
Thank you so much. Online, Mayor Collins.
Hi, my name is Wilmot Collins, and I'm with the City of Helena, and also with the Department of Health and Human Services, Child and Family Services Division as a Child Protection Specialist. Thank you.
Thank you. Mayor Harris.
Yeah, I'm probably the most boring one here. I'm Kelly Harris with the City of East Helena. We already met Mr. Payne a couple times in our other role in this board. Yeah, I just serve at the pleasure of the City of East Helena.
Thanks, Kelly. What do you do when you're not being a mayor?
So when I'm working a job that gets me paid, I work for the Department of Labor and Industry as a plan reviewer.
As a what?
Plan reviewer, like building plans.
Oh, great. Thank you.
Exciting stuff. Either job, really.
Appreciate it. Lisa Kaufman.
Hi, I'm Lisa Kaufman. I am in the last year of my first term. I work for a paycheck at the Department of Environmental Quality in the Public Water Supply Bureau. I'm the field services supervisor.
Thank you so much, Lisa. And let's see, Catherine Weber.
Hi, I'm Catherine. Also in my last year of my first term, I am currently employed as a pre-admission nurse over at Helena Surgery Center. I've been a nurse for 29 years and serve as a community representative outside the city of Helena.
Thank you, everybody. Thanks for the introductions. I think it's just nice to let us all know who we're, serving together with. So we'll go back to the agenda and we can review the agenda and then if anybody has any revisions, please speak up.
Madam Chair, I ask that the annual Board of Health Conflict of Interest be postponed until February. I was relying on the Department of Public Health and Human Services to provide me that document, and it's being delayed at their legal department.
Those rotten lawyers.
That sounds good.
So we can postpone until February for that one. Great.
Okay. Any other changes? Okay, let's move on to review and approval of the minutes. 3. Any edits or changes requested? Hearing none, they are approved, and we will move into introductions of new staff and employee recognition.
Thank you, Madam Chair. To begin, I would like supervisors to introduce their new staff. And so Jennifer is with us to introduce one of her new staff in the Water Quality District.
Good afternoon. Can you hear me?
Yes, we can.
Okay, great. I'm Jennifer McBroom, and I'm the supervisor for the Water Quality Protection District. And I am here to introduce Natalie Emerson. And I just wanted to give you a little bit, I think you heard a little bit about our situation back in October when I introduced our hydrogeologist, but just wanted to reiterate that I am very, very happy. We are fully staffed now. Our water quality specialist left back in October of 2023, and we had a very quick turnaround. We hired Natalie, and she started mid-November. But just also wanted to let you know, though, too, is that hydrogeologist, that position was vacant for about 19 months. So, so what that means for us is now we're kind of getting down and looking at our plans, looking at our projects, our networks. And so I'm very, very happy having Natalie here. She really has hit the ground running when she got here. Cold weather, bad weather, she's out there doing field work. She's looking at our equipment that hasn't been really looked at since I've been here. And I started back in 2006. So very excited to get everything organized and up and running and starting our new, just really getting on our field season here in a few months. So, but you don't want to hear from me. I'll let her talk a little bit about how she came to be with the Water Quality Protection District.
Hi, I'm Natalie, and so I've only been here for about 2 months, but right now I am going to the groundwater wells that we have, private homeowner wells that we monitor right now. So I'm kind of just getting my bearings and knowing and understanding those wells, and then just helping Jennifer go through our equipment and then going through kind of like our forms and procedures and other things and revising all of that. But before I had this job, I had a temporary position at DEQ before this in the monitoring and assessment section, working on primarily stream water quality work. And then before that, I was in Wisconsin and I graduated from the University of Wisconsin-Stevens Point there.
What was your degree in, Natalie?
Water resources and soil sciences.
Well, welcome, Natalie. We're happy to have you, and congrats, Jennifer, on having a full staff and your board's full. So I think these, the spring's looking great. Okay.
And then I'd like Sarah to introduce her new staff.
Thank you, Madam Chair and members of the board. I'm Sarah Sandow. I'm the Community Health Promotion Division Administrator here at Lewis and Clark Public Health. And I'm really excited to announce a current staff who's also going to be a new staff. So when I moved up to this position, we had the open position of our Behavioral Health and Chronic Disease Supervisor. That position supervises 7 staff with a variety of topics from suicide prevention to the Connect referral system to tobacco prevention. A wide variety. And so we're really excited to announce Julie Burr. Julie's been here for 5 years, and she's been our Connect referral coordinator as well as our systems improvement specialist. She's the reason accreditation went so smoothly, and she's been really vital to the prevention team for the last 5 years. So we're excited to see Julie in this new role and where she takes it. So I'll pass it to Julie.
Thank you, Sarah. Madam Chair and members of the board, you've heard me present about Connect and I think inclusiveness, if I'm remembering right. Maybe QI, I don't remember. But I'm really excited to take on this new role. I'm on day 4 and still barely know my title. It's rather long, but I have such an incredible team that I'll be working with, and honored to be learning from Sarah and the other great supervisors we have. So I'm sure you'll be hearing more from me going forward. So thank you all for the moment of your time.
Congratulations, Julie.
So thrilled to have not only one of our staff kind of elevate up into a leadership and a supervisor position, but to also bring in new staff like Natalie. So, and at this time, I get the privilege of introducing our employee of the quarter. So every quarter, we do some recognition of a staff person who has gone above and beyond, who has really just been a shining star in the health department. These nominations are peer nominations, so it's within the health department. Staff are identified as being rock stars and nominated, and then our administration team then selects from the nominations that come in. So I'm so thrilled to announce that this quarter, Artis Sullivan is our employee of the quarter. And Artis is our billing clerk. So what that means is that she brings in lots of revenue for us for services that we're able to bill public and private insurance for. So immunization services, she does WIC billing as well for nutrition services. I don't know what we would do without Artis, because she really does. She is the most tenacious person that I know when it comes to really figuring out how to make the most of our ability to bill. So health departments, it's not our forte, it's not our expertise. We're not a health center, we're not a hospital, but it's so important to be able to recoup some revenue for some of the services that we do provide. And it's Artis who makes sure that that revenue flows in for us. And I'll just share one small story, and then I'm going to turn this over to her supervisor, Shelley, to say a little bit more. But we adopted a new electronic health record not that long ago. It was actually during COVID, which made it even more complex to bring on a new electronic health system. And so Patagonia is that system that we adopted. And so not only did we all have to, staff had to learn how to use that, but poor Artis had to figure out how to use this new system in order to bill. And that was quite a feat. She was so persistent in learning, but also has put a lot of pressure on Patagonia to perform the way it's supposed to so that we can bill properly. And so she really held their feet to the fire and continues to hold their feet to the fire, because that's a system we pay a lot of money for, and it wasn't doing what it was supposed to do. And she made sure that it was, so, and continues to. So thank you, Artis, for everything that you do for the health department. This is a well-deserved recognition. So Shelley, what would you like to add?
Yeah, I'll just say that Artis definitely deserves it. She has been here for many years. I've worked with her many years, and she, like you said, she is persistent. Like we do very few write-offs. she digs down until she can get the money. And she tries to make it so the patient doesn't have to pay for it either. She bugs the insurance companies, she finds other ways to pay for it. So she's really good at not only giving us revenue, but protecting our community, especially those who we serve usually that don't have insurance and are lower income and really can't afford it. So she does awesome. I sit on webinars with her on the state billing webinars, and they always, artists, what do you mean you bill for WIC? What does that mean? We don't do that. So we're kind of above and beyond a lot of the health departments in that aspect too. So she works with the whole team, and she's awesome. But I think the number one thing about her is, I don't know if you've heard her laugh. She has a unique laugh, and it's so contagious. And she's always laughing and always pleasant and always happy. And so very well deserved.
So here is your certificate of appreciation from us to you. We love what you do, Rafa. Thank you so much for all of
that.
Yeah,
she didn't want to talk, but do you want to say anything?
I'm just grateful. Thank you. I love my
We want to
job.
hear you laugh. We want to hear you laugh.
Oh, don't worry, you'll hear that. I have stories of me laughing and people across the room start laughing because I'm laughing. Yes. So thank you.
Thank you.
Thanks, artists. Thanks for being a leader within the health department, but a leader in the state of Montana around billing as well. So thank you.
And on that note, I get to go call an insurance company.
Good luck.
Thanks, artists. Thank you, Madam Chair.
Thank you. All right, we will move into action items, the on-site wastewater variance ratification. With Lisa.
Thank you, Madam Chair and members of the board. On Monday, January 22nd, a variance hearing was held for the property located at 1022 Trails End Road in Helena in the Valley. A variance from the setback requirement in section 4.3 sub 1, specifically the 100-foot distance to a 100-year floodplain. The property is approximately 1 acre and has a single-family residence located on it. It is a rental property. The current septic system is failing, and the replacement system cannot meet the 100-foot, 100-year floodplain setback. This property, what is important to note that the property was developed or platted before the boundaries of the 100-year floodplain were delineated. There is no municipal wastewater collection system available, and there's no viable option for locating the replacement system on a neighboring property. The current failing system is also within 100 foot of a neighbor's well. And the recommendation for the type of system to be put in would be a sand line pressure dose system. So while the soils in that vicinity are gravelly, sandy loams and the percolation is good, it's too good. And so the sand will not only further treat the septage or the septic effluent, it will also slow down that percolation. The proposed location of that replacement system will be about 20 foot to the 100-year floodplain. So it won't be in the 100-year floodplain. It just can't meet the 100-foot setback. Because of these improvements and the staff recommendation of having all tank openings be watertight, I recommend approval of this variance. Does anybody have any questions?
So when you said it's 100 feet away from the floodplain, 100-year floodplain, how far away is it away from the structure? Is it 80 feet or?
So it's not located 100 feet from the 100-year floodplain. It'll only be located, the replacement system will only be located about 20 feet from the 100-year floodplain. It's able to meet all the other required setbacks, 10 foot from the property line. It will improve the distance from the neighbor's well from about 80 foot to the neighbor's well to well more than 100. Trying to think what else. The type of system is important to note that it is designed for these types of soils. So it's an improvement of the existing system. And the whole 1 acre lot was platted before there ever was a floodplain in the area. So the area for the replacement field is also not outside of, 100 feet away from that 100-year floodplain.
Lisa, the floodplain was there. It just hadn't been designated by the governmental entities, but that floodplain has been there for a long time.
Right. It was not delineated. So therefore, when that COSA or when that subdivision was approved, there was no delineation of that 100-year floodplain for them to require the setback.
Pretty good map there.
Yeah,
In our materials, and it shows the distances.
The map that Commissioner Payne is referring to is on page 25 of your packet. That might help get a visual of the floodplain as well as where the new septic system and drain field are expected to be constructed, if that helps at all.
I thought the attachments were very helpful, so the map, it really sets it out.
Is there any further discussion or questions?
When Brenda came in and visited with me about this, so I would not ask a lot of questions and delay things, but she also pointed out to me that the replacement drain field is one that will be sealed so that even if the floodwaters do come up, it won't be able to wash in the top, or the lid is not set down in the concrete so that the water, it looks like a huge improvement in the design, and I'm very pleased with that because it looks to me like there's going to be a bunch of these failures. This is there's 4 houses in this subdivision, and they're going to have those problems.
And thanks, Commissioner Payne. And the just clarification. The watertight lids and the risers that you're referring to are relevant to the tank itself, not the drain field. So the 2 different pieces to the septic system. So that the risers and the watertight lids are equipped on the tank, but for the very reason that you described, that if there are floodwaters, the tank itself is protected from those floodwaters. Beth has taught me well.
Great questions and discussion. Anything further, board members? Okay, not hearing any, then it's an action item. So all in favor of, can I have a motion, please?
I'll make a motion to approve the variance.
Second.
Thank you. All in favor of sorry.
Any further discussion?
Slow me down here.
Any further discussion?
Any further discussion?
Any public comment?
And is there any public comment? We can't see if there's anybody out there.
Jolene can for you.
I don't see any at this moment.
Okay, so now I think we're ready to take action. All in favor of approving this variance, say aye.
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 All opposed? Thank you. It passes. Okay, and we will now move on to the board discussion. Licensed establishment cooperative agreement with Laura. Please.
Good afternoon, Madam Chair, members of the board. I'm Laurel Breek. I am the administrator of the newly combined Environmental Health Services Disease Control and Prevention Divisions. And just this week, we have a new name. It's going to be environmental health and disease prevention. Not a whole lot shorter, but you know, I don't have two breaths to say it.
And the acronym will be
I haven't got that far.
EHDP.
DP.
Okay, see.
Must be, yeah. On page 29 of your board packet, you will find the environmental health and food safety licensing task order. That has all of the legal language required in having agreements of this type. In the past, we've brought a cooperative agreement for licensed establishments to the Board of Health for approval for all the work that we do in these licensed establishments. The task order is replacing the cooperative agreement between Montana Department of Public Health and Human Services and the Board of Health, and must be approved by the Board of County Commissioners. The establishment license fees are collected by DPHHS and placed in a local board inspection fund. This annual agreement establishes a payment schedule that maximizes the disbursement to all of the local health jurisdictions to support inspections of these licensed facilities. The programs that are part of this task order include retail and wholesale food, public accommodations, public pools and spas, trailer courts and campgrounds, as well as, I hope I said public accommodations. I got lost in my list. Sorry about that. We have continued our option to not do the body art program, as it requires a lot of specific knowledge and for very few facilities. So at this time, and it has been in the past, is that the state health department does those inspections in Lewis and Clark County.
Are we talking about tattoos?
Yes.
Thank you. Just.
As well as piercings and other types of body art.
Oh, okay.
The state office, okay, sorry. We will conduct pool and spa inspections. We are making that choice. Continuing on, and then plan reviews for trailer courts and campgrounds in partnership with our environmental health team. We also plan to offer assistance in peer-to-peer training with other sanitarians across the state when we are able to do that with current staffing. This agreement was developed over a period of time to eliminate payment disputes. The tables and percentages clearly indicate what work is needed to obtain the full allocation to our county. Our payments are based on the number of license fees that are received. We will be receiving $61,546 from 692 licenses paid in 2023. Those are predominantly food establishments with 453 licensed food facilities. License fees pay for 13% of our program costs. Local taxpayer dollars make up the remaining 87% of the budget required to operate this program. These fees pay for one inspection per year for most of those licenses, but we do have 2 inspections required for the 40 year-round pools and spas. The National Retail Food Program standards recommend that the number of inspections per year for food facilities be based on risk, which could be up to 4 times per year, and we get out there once. All of our license fees are located in statute, making it difficult to keep these current. The retail food fees have not been updated since 2009, while costs to fund our program continue to climb. I am currently sitting on a committee to evaluate methods to advocate for equitable fee increases during the 2025 legislative session. We make our decisions on our activities locally based under this agreement based on the risk to public health. Inspections are one part of what we do. Our programs involve plan reviews, technical assistance, education, complaint and communicable disease investigations, as well as those routine inspections. Even though this is going before the Board of County Commissioners for approval, we believe it's still important to keep the board informed of this work because of your Title 50 statutory requirements to protect public health through strategies like inspections. I'm happy to answer any questions that you have.
Commissioner Payne?
Thank you. You spoke about the body art, and in the scope of work, attachment A, there's a list of number 4 is to conduct body art inspection, blah, blah, and then there's a yes box or a no box. And when does it get checked that it's no?
It is currently checked no, and it is a DocuSign document that goes before the commission.
Yes.
And so that document has all of those X's on it. And this was a PDF that we were given of it, and I didn't get that done before I put it into the board packet.
Okay.
I apologize for the confusion.
That's
The version that you'll see when it goes before a commission for approval will have all of the boxes checked correctly.
sure. Okay. And because I will be on the commission making final determination of this, of course, I will recuse myself from voting on it today.
There's no action item. In the past, as Laurel stated, in the past, this was an action item for the Board of Health. It was a cooperative agreement between the state and the Board of Health, and they've changed that this year. That this is the first year that it is a task order that will go before the county commission instead. So, which is why Laurel's here still before the Board of Health, because it's important, even though it's no longer an action item for the board, because of the Title 50 obligations, important that the board understand that we are entering into agreement to do this work. But the actual approval will occur through the commission as a task order, which is similar to many of the other, as you know, many of the other grants that we get from the state of Montana come to us as a task order, that it gets approved by the commission. This was never done that way because it's not a grant. These are fees that are collected at the local level, go into a fund at the state, and then come back to us to do the work at the local level, but it's being treated like a grant. So it was changed into a task order just this year. This is new process.
One.
But I think it's really important to have it in front of the Board of Health as making sure everybody knows who's doing what and these bases are being covered. So thanks for including it.
I have a question. So it sounds like this work is in statute. We must, as a county, provide these services.
Yes.
But it sounds like we're doing the bare minimum because of the funding. And I know that our budget and the county's budget, it's been hard this year. So as we've had to decrease force with health department services towards sanitation because of our budget, like what might we see? I know that this will get done, but what might we see like throughout the year, with that, like the smaller amount of cash that you need to really do what the best practice standards are for your expertise, if you can.
I'm not quite sure I understand your question. We are going to continue what we've always done, and that is to be out there doing inspections, following up on complaints and following up on bad inspections if we have some, to make sure that people know what they need to do and are protecting our community from foodborne illness.
And if I may, Madam Chair, just add to that, I have kept the board abreast of preparations for fiscal year 25 budget. And we all know that we're having to do some downsizing in order to meet those budget constraints. This is a program that it's foundational public health work, and we are prioritizing maintaining our current staff to do the work. But I will just reiterate that we're doing the bare minimum. We're doing the one inspection that's required when national standards say we really should be doing 4 inspections a year. So we will do the very best that we can to meet those minimum requirements. But it's unfortunate that we, because of budget constraints and the fact that we're only getting enough, it's 13% of what it costs to actually operate this program from the fees, that we're not able to do more. Okay, our staffing is, we don't even have adequate staffing to barely meet the minimum. So we're going to maintain the staffing for this program as we work on our fiscal year 25 budget. So it will not see a cut, but our expenses continue to rise. Our revenue doesn't rise at the same rate. And we do the best that we can with the resources that we have, which is not enough.
Is that a similar practice in the sanitation department to all the other health departments in the other counties that are probably similar in size to Lewis and Clark County?
Yeah, so Cascade County comes to mind. They have some real limiting factors there and some real challenges there when it comes to staffing and what they pay their sanitarians there to do this work. But that is an example. It's a county that's larger than ours, has more establishments than ours, and they can't meet their minimum inspection requirement because they don't have the staff to do it. So it's a challenge across the state, and I'm so grateful that we have a dedicated team of sanitarians, that it's a consistent team, it's a strong team. And they get out there and they do the best that they can. But the budget piece of that work is really challenging, which is why we're participating in statewide efforts to look to the legislature. They're the only ones that can make that change. It's set in statute. So we're hoping that in the 2025 legislative session, there will be a bill for those legislators to consider raising the fees. And our state public health association is doing some interim work and will be prepared for the session.
Might I also, excuse me, Madam Chair, I'm really not good at procedure. I'm hoping that not only will the board do what they can to lobby our legislators, but each one of us as individuals, we know people in the legislature. And if we don't, we should. They represent us. And it seems like for some reason, the legislature thinks that the counties are taking advantage of the voters. And yet they keep giving us more and more work to do and less ability to charge for it. And I'm feeling very frustrated about this whole thing. So when you talk to, and the Helena legislators are pretty good about it. However, they need to, the squeaky wheel gets the grease. And so this is an important part of making them listen. One inspection a year is not enough. How can we protect these people? It's our job. So I'm hoping that each individual, and I don't mean to not include you folks too, because each of you votes, pays taxes, eats in restaurants. So be sure when you have the attention of a legislator or their wife or their husband or their kids, let them know how. I was just shocked to find out that you're only allowed one. I mean, the money isn't there, and it isn't that nobody's stopping you. It's just, it has to be paid for. So we need some help, voters.
And in addition to that, the Montana Association of Counties, at their December meeting, voted to also support this effort to take it before a legislature for consideration. So we do have the Montana Association of Counties supporting this effort as well, which is really great.
And then our governor seems to think that our county services, our costs are way too high and we should cut back on those. So we need to talk to our legislators. They do listen.
Thank you. I think that's really great to remind us all of
And your
ability to-
friends, and you know, when you're out there drinking beer or playing cards or going to church, you can talk about these and how important it is.
Any other board discussion from the internet?
Mayor Collins, do you have anything to add? There he is. I just wanted to make sure you're still here.
Oh, I'm here, Commissioner. No, I don't. I'm listening.
Well, I would certainly welcome you back, you know, any updates that you think, because it sounds like there's a kind of a call of volunteerism in our positions here as board members to help communicate the lack of resources to do a really important job for our public health and our establishment. So please do revisit us anytime there's something you feel like we should know to, you know, kind of keep us in the loop. And if you need us, please ask.
I
But I
see
can-
Representative Dunwell just sent a comment for us, and she's willing to help us in any way possible. So
Yes,
Thank you.
we can always count on Mary Ann.
Mhm. I was going to add, if I may, that this committee that I'm sitting on is currently pulling together a survey from every county that they can solicit one from on the cost of doing inspections. And then this committee is going to look at different ways that we can propose to upgrade these. But there's also going to be a series of listening sessions across the state so that we can involve operators and the public in boards of health and those kinds of entities to really provide some support for what it is that we're doing.
Excellent. Good. Well, thank you for that great report. Anything else, board members? Okay, thanks, Laura. Okay, moving on to the East Helena Superfund update from Beth, please.
Hey there. Good afternoon, Madam Chair, members of the board. My name is Beth Norberg. I am the Environmental Program Supervisor here at Lewis and Clark Public Health and the newly anointed staff member for the East Helena LEAP program, which stands for Lead Education and Assistance. And I am going to go ahead and, of course, share my screen and
While Beth is queuing up her slides, in the packet, page 39 is where you'll find her slides, and then she'll share her screen as well. We're seeing a beautiful grizzly.
Okay. Did you see the bear? But now you can see my screen probably.
Yes.
I switched screens. Okay, that's great. Worked okay first time there. So, and you can see the slide now, not the notes, correct?
Correct.
Okay, good. Great. I don't know why you'd think after all these years, you still get it wrong. So what I wanted to do today was just give a brief update of the East Helena Superfund site. There's a lot that's going to be happening here in the near future. And we'd like to provide kind of an annual update of everything that's going on. Mayor Harris, feel free to chime in. Of course, he's our representative with East Helena, and he's very knowledgeable and involved as well in what's going on here in this community. So with that, in case anyone, I think it was important to kind of set this up, maybe understanding that there is a Superfund site in East Helena still. There was a smelter that operated for over 100 years in East Helena, and that is on the south side of the highway. There's the big black piles there right now that are getting smaller and smaller. There was the actual smelter there, and that has been taken down. It created, what the smelter did was aerial deposition of lead and arsenic. And interestingly enough, the way the airflow, you usually think like west-east in terms of our weather patterns here in this region. But it actually, when we talk about the aerial deposition, it was really kind of more northernly. And so that's really where the city of East Helena and a lot of the residents live, is that north of the smelter. It was shut down in 2001. And in the 1990s and early 2000s is when a lot of the most of the residential yards were cleaned up. There was road aprons and other areas too, but a lot of it relied on that residential yard cleanup, where they took soil out of people's yards and put clean soil in. And then after that, the institutional controls were in place. So those controls are what they say, they're institutional controls, meaning we have done all this remediation, we've done all this cleanup. Now we want to make sure that contamination does not happen again, or no further contamination happens. So we're going to put some controls in place. And with that, at Lewis and Clark County and the LEAP program, we adopted a soils ordinance. So anyone displacing more than 1 cubic yard of soil in the East Helena Superfund, what's called the IC boundary, or the institutional control boundary, needed a permit to move that soil. And it's really just a means to communicate what people are doing with dirt, where are they taking it. We have a repository where people are supposed to take contaminated soil. So it's really just kind of keeping tabs on that. Our permits are free and our certifications are free as well for people displacing soil. So we try to make it as easy as possible while still protecting the residents in East Helena. And so with that, we've been operating under that, the institutional control since 2012. So what are our services at LEAP? Again, that stands for the Lead Education and Assistance Program. We do residential environmental assessments to identify lead sources. So what that means is we do get reports of people with elevated blood lead levels. They go to their doctor, they get a blood test, and if it's beyond the CDC's limit for lead in blood, we will investigate that, and we work with the family or the individual to identify where the source is in their environment and help them remove that source. With that, in East Helena, in the IC boundary, we provide blood lead testing for families. That's covered through those activities. We also have a HEPA vacuum lending program. Seems kind of silly, but HEPA vacuums are not cheap, and they are the one thing that really, really helps eliminate lead dust in homes, and not everyone has a HEPA vacuum. So we have a lending program where we can lend to families to, do that vacuuming and make sure their home is safe for them and their children. Children, going back, I mean, we're concerned about all the residents, but children are of the highest risk when we're talking about lead poisoning. So that's where we really want to make sure that we reduce those rates of lead poisoning in children. Children absorb lead into their body and they don't let it go very easily like adults do. And that's where the health effects can come into play with children. And that leads to education and outreach. So we do a lot of education and outreach with families and really urging people to get their children's blood lead tested to establish that baseline of where they're at in their environment. And then, of course, the institutional controls are the regulations on moving and disturbing soil in the area. So again, like I said, we require permits and certifications. So those are kind of the main LEAP services that we offer. We also work very closely with the, Environmental Protection Agency and the Environmental Trust Group on their activities as well. What we did last year, so this is just calendar year, we investigated 14 elevated blood lead levels within the boundary. Most all of those, I want to say actually all of them were children under the age of 16. We conducted out of that 3 environmental assessments. So we'll reach out to these families. If they want to do an environmental assessment, we will go in and do it. If they don't, it ends there, and we just provide that education for them on hopefully reducing that risk in their environment. We also do monthly first-time homebuyer classes, which has become really important for us to reach out to those people buying a first home, and do they understand lead and lead poisoning and what the risk might be and what to look for. We did the Christmas stroll this year for the first time in a few years, and that was really fun. And we talked to a lot of residents in East Helena, really kind of reintroduced ourselves. It was actually really fun, exhausting, but fun. It was good. And then we've started up our lead coalition, Lewis and Clark County Lead Coalition, of people, interested stakeholders in trying to make sure that we are getting as many children tested for lead poisoning as possible. And we actually just had our first meeting on Tuesday. So then, of course, with the regulation, we issued 7 soil displacement permits not too many. I think that number is going to pop up here this year. But there was kind of a lull, and now, of course, there's all the redevelopment going on in East Helena, so we'll see a lot of activity around soil displacement permits here this year. We did have one enforcement action. It was a rather bit of a doozy, but we were able to take care of it. And then we certified 45 people, though. So we reached 45 contractors, people moving soil, and made sure they understood what the risks were working within the Superfund area and how to protect them and their families. We've been supporting EPA activities. So EPA has proposed, if anyone has not heard, lowering cleanup levels to 400 parts per million. So what does that mean? Back in the day, the limit for cleanup was 1,000 parts per million of lead in soil. And that was the level. So then what they did is if it was above 1,000 parts per million, your yard was cleaned up. And they would clean it up to at least 500 or below. So they would clean it up to 500 parts per million or below. What EPA is proposing is lowering that cleanup level from that 1,000 parts per million to 400 parts per million. So pretty much we're going to have everything between that 400 and 500. They did a large residential sampling event last April, and they found, I think, about 50 properties or so that, you know, that were elevated, and they want to go in and they want to clean up further. They'll probably end up cleaning well below 400 parts per million. But they're going to be doing a lot of activities, and I'm probably not Bridget Williams with the EPA. She's the remedial project manager. She's probably telling me I'm not saying it right, but there's going to be a lot around that. And so we're going to support those efforts. We're going to work with them on, you know, again, permitting and making sure that we're all on the same page of getting a lot of those residential yards cleaned up. And the news from that is that, you know, people are not really necessarily opposed to it. They're really kind of like, well, how come my yard wasn't cleaned up to begin with? And so let's do it this time. So it should be an interesting process to revisit that. We're also supporting the METG, that's the Montana Environmental Trust Group. There's the East Helena redevelopment, we call it. It's kind of everything south of the highway. We have Habitat for Humanity, who has a large lot that they're turning into residences and multifamily, and there's a private Oakland companies who also did the subdivision over by the high school and the elementary school. They're going to be doing home building and commercial facilities, and so there's going to be a lot going on that south side of the highway. There's going to be a lot of redevelopment and things happening. Of course, Prickly Pear Land Trust is going to be doing a lot with their Greenway project and Prickly Pear Creek Park and some things there. So really exciting times for East Helena, actually. I think it's something to look forward to. It will have its challenges, but I'm looking forward to it. I can't wait to see, you know, what comes of all of this. We just did a new cooperative agreement with the EPA, so that outlined a lot of our activities that we're going to be doing over the next 5 years. So we did all of this last year, and then upcoming for this year, we're just going to continue on the path. We're going to continue to investigate our elevated blood lead levels. We're going to continue to permit, do our certification and enforcement. We will definitely be increasing our outreach and education activities, especially with what EPA is going to be doing there in the Superfund area. We're looking at maybe some community lead testing events. We're going to be doing a lot with our stakeholders and other outreach events we have planned, and of course our lead coalition. So we're going to ramp a lot of those things up. Everything was kind of at a lull there for a while with East Helena because we had the ICs in place. You know, we were doing permitting. We were just kind of doing this, but there's going to be a lot of changes happening for this community, and we're going to be here to hopefully support them through all of that. We need to do a refresher and get some people certified in lead inspector and risk assessor training, which is always it's a 40-hour class that we need to do. And for you guys as the Board of Health and the local governing body, we are going to update our soils regulation. So we need to update our soils regulation to match whatever it is the EPA, whatever that number is. If it's that 400 parts per million, we need to then update our regulation to match that. I'm hoping should be relatively painless and a really good kind of a practice, if you will, because I don't know if we've had a regulation that we've had to take through the local governing body. I can't say it. But first it has to come to you guys. And this is going to be important for you when you get that, to really take a look at it and do that regulation. So with that, any questions or anything that you guys might have for me?
Sure. Okay. Of course, I have a question.
Okay.
What do they do with the dirt that has the lead in it? And I know they do something, but
yeah, so
they maybe ship it to Butte.
Yeah, Commissioner Payne, that's a really great question. We actually have a soils repository. So the repository actually operated for a number of years south of the highway, right on, I say the corner, it would be the southeast corner of where highway, is it 282 and highway 12 meet there.
Where the Kiwanis log cabin is?
Yeah, there's a, yeah, in that area, yes. And that is where the repository always has been. That repository has now moved because the repository area is now going to be redeveloped into part of this large East Helena redevelopment. And so all of that has been moved. We have a new repository now on the west side of the highway. I have a map, I can get it to you, but so it has moved, but that is where all the soil, if you're going to take it, you need to take it to the repository. That's very specific.
So when you say they move that, what, they load it back up into trucks and haul it across the highway?
Yeah.
And
They
so
moved all that dirt, then they'll
create-
repeat that area, and then that'll be ready now for redevelopment.
So doesn't that dust go into the air and get the lead into the air and cause further issues?
Right. So they have to practice things like, wetting the soil, not making sure you're just spreading too much dust around. So you have to be very careful about when you're moving that soil. You have to make sure you're not, say, a windy day. Like I said, you need to use suppression to make sure that does not happen.
Who does that?
That was done by, and Mayor Harris, you may know, I want to say that was done probably by a contractor that was hired through the trust, potentially.
It's not all completed yet, but the trust group has been the lead on that. And so they've had some of their own individuals who are trained to move it, and as well as some contractors move some, but it's not complete at this point. Also, just to jump in here a little bit real quick, it's real important for my community. I don't claim to be a scientist or all that real knowledgeable about how the body assimilates lead, but as science changes, as we get more understanding and the EPA, comes out with new standards, it's important that we protect our community. And, you mentioned the kids, but all of us in the community of East Helena need that. And, as an entity, the Board of Health, I appreciate the support, going forward with, adopting these rules and these standards. Science is a fluid thing, we're certainly learning every day, and there's people way smarter than me and any other East Helena kid that are doing these things. And we just appreciate that there is a concern, and that we're looking out for these the people that live in my community. And Justin knows as well as I do. We can look at that pile of slag and see a lot of people we knew growing up's hard work, and respect them as individuals, but as an entity, that corporation left a pretty substantial economic tear on my community, and then just embracing the science as it goes forward is really important to us as a community.
Very well said.
Any other questions or comments or discussion about the presentation? Beth, I had one, just when you were talking about testing kids, is it just East Helena kids, or are you doing the Helena area because people like to move around?
Yeah, so interesting you should ask. Yes, specific to the Superfund site, we pay, or EPA pays for blood lead testing for those. I mean, that cost is covered. Outside of East Helena, we also do investigate everyone with an elevated blood lead level. in all of Lewis and Clark County. So we're not going to ignore someone who lives across the border. We are going to investigate that. We are going to work with the family. And then we do have secured a task order. We have a task order with DPHHS right now with their childhood lead poisoning prevention program. And there are funds that we have received so that if private insurance or Medicaid well, Medicaid covers it if you're a person enrolled in Medicaid. But if your private insurance doesn't cover it, we can help get that test paid for as well through those CLIP, Childhood Lead Poisoning Prevention Program funds. So that's something we will still work on if we feel the need to do that. So we're not going to ignore everyone else because we have a mansion district, we have lead-based paint, right? So we have all these other things, and our lead burden is, it's a lot. And so we want to make sure that everyone is taken care of. But of course, with the Superfund site, that comes with everything involved with that.
And Beth, correct me if I'm wrong, but we are required to investigate every elevated blood lead, regardless of where they live in the county. So we have to do that work. So it does get done. It just gets funded differently than what the East Helena. So yet another example of required work that we have to figure out how to fund, because EPA funding only covers the East Helena area. So
yeah, and we were never funded before. We just did it and figured it out. But we did have to be a little choosy on, when do we go do an environmental assessment? When do we not? When do we? But luckily with our task order, we've gotten some extra funding to be able to expand that more.
Yeah, that program has relied on our mill or our local tax dollars to support work outside of the Superfund site. So we're grateful to have this task order, to this additional funding to help. So
Great discussion. Anything else before we move along? Okay, thanks, Beth.
Thanks.
Okay, Drenda, fiscal year 24 second quarter finance report.
Thank you, Madam Chair, members of the board. You get me today because Heather is home with a sick child. And so I'm going to do my very best to give you the Q2 finance report. So on page 42 and 43 of your board packet, starting with page 42, the top section, it's labeled revenue. This is a combination of a variety of revenue that is specific to our mill fund. So this isn't all of the revenue that comes into the health department. We have a bunch of grants that are separate from, but we also have a handful of grants that are connected to our mill. We are working with county accounting to clean this up, and you'll see that it looks different in Q3. But right now, our mill fund has taxes and then a bunch of other revenue sources that you see. So cost allocation recovery, health insurance credits, that's our insurance companies that pay for vaccines that we deliver, environmental health charges. So there's a handful of things like site evaluations and septic tank permits that we can charge for. Community health charges. Community health charges are the immunization revenue that comes in through insurance companies. And then we do have almost $400,000 worth of grants that flow through our mill. I'm going to say that it convolutes the picture of our mill fund, but I think it's really important to stop and explain that. But the revenue that we anticipated for fiscal year 24 was just over $3 million. You can see there with a combination of taxes and those other revenue sources. And then if you move across the page to the percent of budget collected, you can see that it says 55.19%, and we are 50% of the way through the fiscal year. So we have brought in more revenue than we anticipated at this point in the year. And if you want to look at the detail, go line by line. So taxes, that's the majority of the revenue that is more than we anticipated. So the tax revenue that comes to the health department to do our work is we collected more than we thought we would. And then the next section down, these are expenditures related to personnel. So you can see if you go to the very last row and then move over to the column that's percent of budget spent, we are 53.15% spent for personnel expenses, and again 50% of the way through the year. So we are spending at a little bit greater rate than we budgeted. And then on page 43.
Yep. Brenda, before you move on,
Yes,
I'm looking at this last table and under personnel, temporary seasonal salary, it's 936.22%. That seems odd. I mean, how?
Yeah, Commissioner Payne, we budgeted the $1,200 for temporary seasonal, and we actually needed more temporary help than we thought we would need.
Can you give me an example?
Yes. So for example, in our licensed establishment program, we have had temporary staff help fill gaps because we had a permanent staff that wasn't able to work their regular schedule. So we had temporary staff come on to fill that gap, but it was a budget neutral decision. It's just categorized as temporary instead of regular salary. So you can, the regular staff didn't work their regular hours. We added temporary staff to fill that gap. So it was budget neutral. But that's an example of temporary staff that we've been paying for that we didn't budget for.
So would that then balance out there's two categories with nothing in them, overtime and term pay, uncomp, absences and extra pay periods. So is that why it works?
Well, it works for personnel. And again, we have grants that are convoluting this picture for you. But so we have some things in here that are above and beyond, that go above and beyond our grant or just our mill fund, because those grants are in there too. But you know, if you think about it in an overall picture, our personnel were spending at a little bit greater rate than we had budgeted. But our revenue is also coming in at a higher rate than we anticipated. So overall, I think we're okay, but that's something that we have to keep a really close eye on.
Thank you.
And then on page 43, this is a very detailed breakdown of our operational expenses. So we just talked about personnel expenses. Page 43 is all of our operating expenses. And again, we have grants that are mixed up in here. But what's important is that we look down at the very last row for total operations, and we're spending 66% of our budgeted operations, and we're 50% of the way through the year. So we have a higher spend for operations than we budgeted for. So big picture, we're going to be okay, because some of this has to do with grants that we received but didn't get put in the budget because we received them after the budget was built. That's skewing our picture a little bit. But I think the message that I want to send is two. The first message is we're $132,000 more in revenue this year than we were this time last year. And we're 55% in revenue. So I think we're doing okay as far as revenue, but our expenses are higher also than we anticipated them to be when we built the budget. It's by the end of the fiscal year, it will balance itself out. And the reason why I'm confident of that is because many of the overspent categories and operations are grant related. They're not mill related. So I'll give you an example of that. Printing, it's just over a third of the way down the page. It's 32.10 printing category. We're over 200% spent in that category, but most of those expenses are grant related. Advertising is another category that we are way overspent in advertising, but it's grant related. Up at the top, operating supplies, we're 352% spent. Those are all grant related expenses. So the 66% is skewed because we have these grants that are muddying in the picture for us. And so
that went down.
Oh, Lisa and Catherine, are you still there? And you're hearing us okay?
Yep.
Okay, so I think we just lost Jolene.
Okay.
So we'll keep going and hope that she jumps back on again.
Bookkeeping is not my forte.
Sure.
But couldn't you put in another column that says which ones are grants?
Yeah.
So that it would give us a more realistic picture of the money.
Yeah, better yet, we're going to take all those grants out of there. So this predates me. It predates Heather, our finance director. It predates, it's back in when Nancy was here. So it predates Frank as the county finance officer. And the decision to put all these grants into our mill fund like this it was mostly due to the fact that our finance system only allowed for certain number of funds to be added.
Oh.
And so this fund is called 227, and we were only allowed to have so many funds in the accounting system. And so in order to allow for all of these grants, they made the decision years ago to put those grants into the mill as a project. So I'm getting way into the weeds, and but I guess to answer your question, we're going to clean up this picture before we start.
On behalf of the county, thank God.
And it's because
it's confusing.
And the only reason why we're able to is because the county is adopting a new accounting system that allows us to do it.
Nope.
So because we are able to get a specific fund to put those grants in, well, Heather will be able to tease all of those out of our mill fund, and it will clean up our picture for us. So
I'm so glad.
Yes, me too. Because she spends hours every quarter giving us finance sheets so that we can see what's going on. And she has to take all of the grant expenses out and create individual sheets for us so that we can just look at the mill, and then we can just look at the grants so that we can manage and monitor the spending.
Do you have a sense of how much actual spend? I mean, for some of these numbers that are in the 200 to 350%, 100%, I mean, 1700%.
Yep.
And it still comes to 66% of total spend year to date. Do we have a sense, if you pull all those high numbers out there, grant associated, what the total spend would be?
Yeah, it's closer to it's closer to that 50%.
50. Okay.
Yeah.
You mean, I'm not the only one confused by this. Thank you for.
No, I've
I've
been through it many years. I always know we have to pull out the grants. There's multiple spreadsheets.
Yeah.
And then just getting an idea of how many, I mean, so many of this is such high percentages that it skews the
It certainly
picture.
frightens the heck out of me.
Yep, yeah. So I would say that we're okay, but we're not great.
Okay.
So moving into budgeting for fiscal year 25, we're not going to end the year saving any money. We'll end the year kind of neutral. So neutral is okay.
perfect.
If you look here at the bottom of page 43, you'll see a 90-day reserve. So clear at the bottom in the left-hand corner, it says 90-day reserve, $672,000. That's our savings account. And it's at 85 days. Our goal is always 90 days. So our reserve is looking okay. Last quarter, when I came to you with a finance report, it was in the 70s. So our reserve is okay. It's not where it needs to be. And for fiscal year 25, we're not going to be able to rely on that reserve to help us balance our budget. So those are the things that I need the board to hear.
Can you tell why we won't be able to rely on that?
Because we want to keep 90 days and say we need 90-day reserve. And if we were well above 90 days, then the amount above and beyond the 90 days would be available to help us balance. But because we are not at 90 days, it wouldn't be fiscally responsible for us to utilize our savings account.
No, so you guys came back up.
We never got lost.
You never did.
You did, but we didn't.
Okay.
So we just kept going. Okay. Thanks, Julie. So we don't want to use our reserve unless it's above the 90 days.
Okay.
Above 90 days, it would be okay to tap into that reserve a little bit, but below 90 days, we don't want to have to use it. We want to continue to build it so that, I mean, that reserve is there for a reason.
Oh, yeah. No, I just felt like I had a memory of us having to tap into that in the past.
We have always.
Yeah.
Yeah,
Okay.
we have. And in the past, we've had a very, very robust savings account.
Yeah.
Before COVID, we were well over 100 days. We were 130 days in our reserve.
Yeah.
So we had good money to tap into as we needed it. But because of the issues that we encountered during COVID, having to utilize our reserve to do our normal operations and our revenue not coming in as it normally would, that's when we lost our reserve. I don't know if you remember, but last year we were clear down to like 17 days of reserve.
I do remember.
So building our reserve back up is really, really important. Ending this fiscal year neutral is my goal. And we have 6 months left and we're watching it carefully. We're going to end neutral. For the sake of all of our brains, we're teasing out the grants so that we can look at these things and have it not be skewed numbers. But the good news is that our reserve is coming. It's bouncing back. Last year, at the same time, we were setting at 599,000 in our reserve, and we're up over 672,000. So those are good, positive things. Again, our revenue we're $132,000 more in revenue this time compared to this time last year. So those are some bright spots, but we also are having to be very, very careful with our spending because our expenses are higher than we budgeted. So.
Okay.
What else can I?
Questions, comments, board members?
It's impressive that the reserve has gone up to 85 days when it was 17 in really a short amount of period. Because that's not easy to do.
No, and I would say there are 2 reasons for that. The county finance officer was very conservative in his estimation of how much property taxes we would bring in. So that was a little more than expected. And then the revenue that we're getting for the services that we can charge for, that's bouncing back. So we're starting to see revenue kind of get back to normal levels again. So both of those things are contributing to a higher level of revenue. That if that trend continues, that's good news for us. So.
Great. Okay, thank you.
I'm so glad you didn't say that Candace Payne was one of the problems.
No. Mm-mm. We've recognized the problem with our mill account for a while, and we didn't have a solution until recently. So we have the ability to track in more detail, but when it comes to presenting to the board, it's been more difficult to summarize for you where we are. We can do it in about 50 pages worth of spreadsheets. And we are doing it in that level of detail, but trying to give the board a picture has been challenging.
There's no question in my mind that I was elected a county commissioner because the taxpayers whose money this is, they want an accounting and they want to know that it's a balanced budget.
Yes.
And if we go to them, I don't know, there's grants in here someplace, I don't know where it is, maybe 50 pages, but in order to cover our butts as far as we're paying attention, we really need that information.
Yep.
So I'm glad you're going after it.
Yep. I think we'll have it'll look very different for you in Q3 because hopefully we're able to get that work done between now and the end of Q3.
Okay, good.
Moving on to the board training on the foundations of public health.
Great. So you get me again.
Like, yes.
Yes.
Thank you.
On page 45 of your board packet are the materials for our board training today. So unfortunately, I've been I guess fortunate or unfortunate, I don't know. You guys can decide at the end of our board training today. I've been waiting so patiently for our state Department of Public Health and Human Services. There's an office that's been working on board training for 2 years. And they've been working in collaboration with the Montana Public Health Training Institute. And it's the training modules are still not done. And I just feel very strongly that you all as board members deserve regular training. So I've taken it upon myself to come up with training materials that I'm hoping to infuse in each of your board meetings. So for today, we're starting out with the 10 essential public health services, and then we will also be discussing the foundational public health services. And so those are the two handouts that you have in your packet for today. So our 10 essential public health services are essentially what are the minimum activities or the minimum the minimum standards, I'll call them standards, the minimum standards that public health departments should be doing in order to protect the residents of our county from exposures to disease and environmental toxins and so forth. These 10 essential services are also the very same services that are expected of us through our public health accreditation. So when we were going through our reaccreditation process, we had to provide very specific documentation of how we're meeting each and every single one of these 10 public health services. So I would say that these 10 are also the filter and the decision-making mechanism that you as a board and then we as a health department need to be using to set strategic priorities in the strategic plan. And then if we have to cut services because our budget needs to be balanced, we need to look to these 10 essential public health services to ensure that we're not cutting where we absolutely have to be doing the work. So it's also a decision-making tool for not only you as a board, but we as a department. So we're going to go through each of these just briefly. I won't, I didn't want to dig into them in too much detail, but I do want to go through them, each of them. So on page 46 is the first. And these 10 are broken into 3 categories. There's an assessment category, a policy development category, and an assurance category. So the first category is assessment, and the first service is assessing and monitoring population health status, factors that influence health and community needs and assets. And so an example of how we meet this particular service or this standard is through our community health assessment that we do every 3 years. That assessment is done in partnership with a handful of other organizations in this community, like Peerview Health Center, St. Peter's Health, Rocky Mountain Development Council, United Way. And we do that because those entities also are required to do a health assessment. So we do it jointly so that it's one assessment that we all can use. That happens every 3 years. The last time we did a community health assessment was in 2021. And so this year we will be doing a fresh new community health assessment. And so I'll be keeping the board apprised of what that looks like. We will be doing a door-to-door survey questionnaire this time, which we have never done before. Cool. We are also doing a multi-county approach because the hospital as well as Peerview are required to do an assessment in their service area. And we fully recognize that their service area goes above and beyond Lewis and Clark County. So this assessment approach this time around will include our neighboring counties as well, which is actually really great because we know that we also share residents. People work and live across those county boundaries. And so that is an example of how we meet that essential public health service is through our community health assessment that's done every 3 years.
This assessment, you go door to door, you hire people to go. How does this work?
It'll be done by volunteer force.
Okay.
And we do get a grant from the state to cover some of the expenses to do the assessment. And the assessment includes a wide variety of data sources. One of them will be this door-to-door questionnaire. There are also data that are collected from the state vital records. So we'll know birth and death records. The BRFSS is it's a phone survey that's done nationally. We'll get the results for our county. That data will be included. The hospital shares their emergency room data. That data gets included. It's a very robust assessment that has multiple data sources and gives us a really nice picture of the health status of residents of the county.
Doing a door-to-door, it just seems overwhelming. It's
a sampling of, so
like
we won't be doing every resident. We will be doing a sampling of residents.
And the CDC gives us that sample, right? Or they're supposed to give us a sample of those in those counties that they want us to do door-to-door knocking on.
We're following a national methodology it's called the Casper survey. And it's been done nationally, and it's supported by the Center for Disease Control. And so they're giving us the methodology. They're giving us, based on our population, they're giving us how many surveys we need to do in order for the survey to be valid and reliable. And then we're using GIS to plot where we're going to be doing the survey so that we get a good representation. So we won't be doing all of the surveys in Helena. We will be doing it across the county and across county lines so that the data that we get will represent the residents who live in the area, in the region.
Fascinating.
Yeah, and again, essentially required work. And it's really important that public health does this because without the data, we don't know where to put resources for the work that gets done in our community, because the data then tells us where the greatest priorities are.
Okay.
Thank you for Peerview and St. Pete's for partnering with us because it's a huge project and it'll be fun. But we'll let the Board of Health know how to engage in the, if you'd like to volunteer and be a part of the door-to-door, we would love to have Board of Health members do that.
And it'll be during the warm season. so.
Yeah, June. It's it'll be
That's key.
the first week in June is when
Yeah.
it's planned. The second essential public health service is investigate, diagnose, and address health problems and hazards affecting the population. So an example of what this looks like in the health department currently is that we have sanitarians and public health nurses that do investigations for many of all of the reportable diseases that are reported to the health department. Not everything is reportable. Toe fungus is not a reportable disease, but Ebola is, measles is,
AIDS.
HIV is, pertussis is a reportable, tuberculosis, of course. Some of the waterborne and foodborne, and Laurel is going to have to help me, but salmonella these are all reportable diseases that have to be investigated. And so that's part of when Laurel was talking about the task order and the inspections that get done with restaurants, the staff that do those inspections are the very same staff that investigate any waterborne, vector-borne, so animal related or like mosquito, rabies, and then foodborne. And then our public health nurses, they not only provide immunization services to the people of this county, but they are also responsible for investigating all of the person-to-person diseases. So flu, COVID, HIV, many STDs, gonorrhea, syphilis, and so forth. And so they are tasked with those investigations. And the purpose of those investigations is to, first of all, know and identify that something is going on in our community. And then our job is to contain it so it doesn't continue to spread through the population. And so that work that they do is essential. It's essential. Another example is our wastewater surveillance. And so that began during COVID. And we work with the two Helena and the East Helena wastewater facilities and then Carroll College to test the wastewater for COVID. So we can it's a passive surveillance that allows us to see what the disease burden is for our county. So that's another example of how we investigate, diagnose, and then we have the ability to then address those diseases that are occurring in our community. If you flip your page, number 3 is communicate effectively to inform and educate people about health factors that influence it and how to improve it. So a couple of really great examples of this work that we do in the health department is our tobacco prevention program. So we are funded through a task order with the state, and we have a tobacco prevention specialist that works really hard in this community to reach our youngest populations and prevent tobacco use from occurring. And she's able to do that through a whole variety of communication mechanisms and education mechanisms. And so she has a whole plan that allows her to get out and work with the youth of our community. They do a really fun social media competition every year where high school students develop a campaign that is a peer-to-peer messaging so that high school students are talking to high school students about the dangers of vaping, for example.
I was just going to say, I hope they're including vaping in this program because that's the scariest.
Yeah, our data shows that vaping's on the rise and tobacco use is on the decline. So
yes,
our data helps us to focus our energies in the areas that are needed the most. And then we have a communication specialist that has a very, very robust communications plan that every month there's a public health topic that gets presented in a wide variety of ways. And so the month of January, for example, the topic was social determinants of health. And so we took lots of different opportunities to teach our community about the social determinants of health and why those are so important to know, understand, and then address in order to improve the health of individuals. So social determinants of health like housing and economic stability and education all impact an individual's health. And so January, there was radio interviews, there was lots of social media posts, there was a article in the newspaper. So there's this really comprehensive communications plan to help our community become more informed about a variety of public health topics. I'm going to take a drink.
Thank you.
All right. So number 4, page 49, strengthen, support, and mobilize communities and partnerships to improve health. This is coalition work. So we either lead or we participate in lots of great coalition work in the community. And the power behind coalition is that the health department can't solve big public health problems. We have to do it in partnership with other stakeholders, other agencies, others in the community that also care about improving health. So we have our behavioral health systems improvement leadership team that's working to improve the behavioral health system. Our local advisory council on behavioral health that's working in partnership with lots of people coming to the table. Our Healthy Communities Coalition is all about chronic disease prevention, and lots of different sectors of our community come to the table to help with that. Suicide prevention and our lead education and education coalition that Beth mentioned, that's another opportunity where we're pulling partners together from across the community to solve big public health problems. Coalitions, exclamation point. Good. Number 5 is creating, champion and implementing policies, plans, and laws that impact health. So a couple of examples of the work that we do around policy development or either creating, implementing, or championing. Sometimes it's not our policy. Sometimes we work with others. And so the 2 examples that I have for you are not our policies. The tobacco-free parks that we did, we partnered with the city Parks and Recs department several years ago to create a tobacco-free park policy. So it's the city's policy, and we were their partner in championing that policy. That is a hard word to say. Another example was just this past legislative session, House Bill 423, and I hope Marianne Dunwell is still on the line to hear us celebrate the firearm liability bill that was passed during the session and protects individuals who want to be helpful in times of behavioral health crisis. Where if Bree shares with me that she is in a behavioral health crisis and wants her firearms to be out of her house, she can give those to me, and I can keep her firearms safe for her while she gets the help that she needs. And then when she's ready to have her firearms back, I can give them back. And if Bree chooses to harm herself with, thank you for letting me use you as an example. If she chooses to harm herself with those firearms, I can't be held liable. So it protects people who want to be helpful when somebody is in a behavioral health crisis. That was a huge win and I say Marianne Dunwell because she was one of the co-sponsors for that bill. And our Suicide Prevention Coalition worked really hard to mobilize support in this community for that bill. Another example is that this Board of Health has adopted their own regulations. You all have the on-site wastewater regulations, the soil displacement regulations in East Helena for the Superfund site, and rabies regulations. You have all of those on the books. Those are policies that you have adopted to protect the health of the community. All right, number 6. utilize legal and regulatory actions designed to improve and protect the public's health. And so again, there are, you as a Board of Health have adopted regulations. On-site wastewater regulations is one of them. Today, during the meeting, you approved a variance to those regulations. And we as public health staff are required to enforce those regulations. And so there are legal enforcement mechanisms that we use when people are not following the regulations that are on the books. The food code is another one. Those are not the Board of Health regulations. They're federal Food and Drug Administration food code regulations, but we're responsible for enforcing them. And those get enforced through our inspections of our sanitarians. So that's a couple of examples of how we work to enforce rules to protect the public.
We've talked about the funding for doing the food inspection specifically. That's a federal law. And do we get funding from the federal government, or is this local taxpayers paying for it?
Go ahead, Laurel.
Sorry, it's a state law. It's a model food code. The FDA has put together a model food code.
Okay.
And states or local jurisdictions or regional jurisdictions or whatever can choose to adopt all or parts of that model food code.
Okay.
And other than the task order that we talked about earlier in the meeting, with the $61,000 coming, that's the money that we get to enforce that food code. So some of the work that I'm talking about today is nicely funded and some is hardly funded, but it's all work that we have to do. It's essentially why public health exists. So number 7 is assure an effective system that enables equitable access to the individual services and care needed to be healthy. So this, oftentimes this is not Lewis and Clark Public Health providing a service, but it's making sure that there are mechanisms in the community that allow people to access care. And so we host the Connect referral system at the health department, which is a really great online referral tool that allows people to get connected to services that they need in the community. We don't provide the service, but we have a tool that allows somebody to get referred from the hospital to Peerview, or from Peerview to housing, or from their pediatrician's office to the Helena Food Bank, or from the school to a private counselor in the community. And so that is a system that we support, and we have staff. You met, Julie was just on earlier. She was our staff that coordinated our Connect referral system. We'll be rehiring that now that she's moved on to her supervisor role. Another example is when individuals come in for their WIC appointments here at the health department, they ask them, those families, a couple of questions. One is, are your kiddos up to date with their vaccinations? And if they're not, they walk them down the hallway to our public health nurse to get their vaccinations cared for. They ask them, do you have a primary care provider? And if not, they walk them down the hallway to Peerview Health Center and get an appointment for a primary care visit. So those are a couple of examples of how we connect people to the services that they need to be healthy. Number 8 is build and support a diverse and skilled public health workforce. So we've moved into that last essential service, and then this one, we've now moved into that assurance category of the essential public health services. So a lot of what I'm going to be talking about now are kind of our internal mechanisms to make sure that we're a highly effective public health department. So building that public health workforce is vital. I'm going to say something that just is really obvious. We can't do the work without the people. And so we have to hire really high quality people. We have to pay them well. We have to treat them well, and we have to train them well. And so that's what this this essential service is all about, is making sure that our workforce is ready to do the work that we're asking them to do and that we're required to do. Number 9, improve and innovate public health functions through ongoing evaluation, research, and continuous quality improvement. So within the health department, we have a quality council. We do ongoing quality improvement training. We've built quality improvement into our performance management mechanisms. So as we're monitoring our strategic plan, we are always identifying if there's a need for quality improvement. We're always learning about new and better ways of doing our work so that we can be more effective and more efficient. We automated our contact tracing for COVID because we were doing rapid quality improvement during COVID. When we started out, we had 70 contact tracers hired to help us do contact tracing for COVID. That wasn't sustainable. We worked in the midst of an emergency. We worked to automate that system so that it's now done through technology instead of hiring 70 people. So we were able to save all of that money that we would have otherwise used to hire contact tracers. We saved all of that because we figured out a way to do it in an automated fashion during the course of a pandemic. Pretty sweet. And then number 10, build and maintain a strong organizational infrastructure for public health. And so these often look like, these are often come in the form of policies. So we have an ethics policy that ensures that we as a health department are doing our work that meet the public health ethical standards. We worked on a review of all of the COVID operations and our COVID response to ensure that to really evaluate whether the work that we did during COVID met those ethical standards. And we are putting that together in a report, and the Board of Health will get this report to show as a review and an evaluation of the work that we did we do it in an ethical way that meets this particular essential public health service, and it also it meets those public health ethical standards as well. So I'm looking forward to giving you that report in the next couple of months when it's done. So in the middle, so that was number 10. That covered all 10 of our public health essential services. In the middle of that graphic is equity. That's there for a reason, and a very, very important reason, because the work that we do has to be done in a way that all residents of this county benefit. And we know based on the data that we collect that there are under-resourced populations that are not receiving services at the same rate as others. We know that some have access and opportunity and some don't. Public health is obligated to make sure that the work that we do is equitably done so that everyone is receiving that benefit. That's why it's at the center, because every single one of those 10 essential services, equity should always be the lens that we're looking at our work. Okay. The next piece is much shorter. That really does set the foundation for our foundational public health services. Really what the 10 essential services is how we do our work. The foundational public health services is it speaks more to what we do. Both the 10 essential services and these foundational services are outlined in Title 50 in Montana Code. So if you were to read Title 50 and what the health department is responsible for, what the Board of Health is responsible for, it will the language that we're talking about is outlined specifically in Title 50. So it's not just, it doesn't just look good on a piece of paper. These are obligations that we are responsible to. So for the foundational public health services, it's broken into two pieces: foundational areas and foundational capabilities. So foundational areas, these are the public health programs. These are the basic public health, topic-specific programs and services aimed at improving the health of the community. These are, they essentially reflect the minimum level of services that every health department should have. And we're going to go through those, not in detail, but we're going to go through each of them so that you know kind of what, at the minimum level, what we should offer, services that we should be offering through our health department. And then the foundational capabilities, this is the infrastructure that allows us to do the work. It's the cross-cutting skills or the capabilities that support the programs that we offer. And so starting on page 59, it outlines the capabilities. So again, this is the infrastructure that allows us to provide the work, or provide the services, do the work. So these capabilities include assessment and surveillance. That's very familiar and aligned with our 10 essential services. It was number 1. Community partnership development, again, aligned with our 10 essential services. I think it was number 4. Equity, again, the way we need to just be doing our business. Organizational competencies like leadership, technology, workforce development, and financial management and legal services. Again, this is the infrastructure that allows us to do our work. Policy development and support, again, aligned with our 10 essential services. And accountability and performance. So are we being held accountable to the work that we're doing? And are we managing our performance to make sure that we are being as effective as we can? Are we having the impact with our work that we intended to? Are we using data to show that we are actually improving the health of our county? Emergency preparedness. That goes without really saying why that's important. I mean, we just survived a global pandemic. If we are not prepared and are not doing the work to be prepared, we will get caught off guard. We won't have the capacity. We won't be able to respond to the next emergency, which will come. Communications is again it's another competency or a capability that we have to have within the health department, because so much of what we do is educating and bringing awareness to people in the public. Without a strong communications mechanism, we can't meet that standard. All right, that comes to our foundational areas. So these again are our programs and our services. So if these are the things that you should see us do as a health department. You should see us do communicable disease control, chronic disease and injury prevention, environmental public health, maternal child health, and access and linkages to care. All of those services should be at minimum present in a public health department. When we did our workforce development assessment and our workforce development plan last year, we did a capacity assessment to see how we were doing in fulfilling these minimum requirements. And there's a national tool that we use to do that assessment and essentially figure out if these are the things at bare minimum we should be doing. Do we have adequate FTE to do the work? And so what that assessment, the outcome of that assessment was that we meet those recommendations in most areas. The areas that we don't have adequate staffing to meet the requirements are around health equity and chronic disease prevention. And so when we plugged in our current staffing, the tool spit back out, using a standardized formula, you should have this many FTE doing that work. And we are short when it comes to both health equity and our chronic disease prevention programs. So we do not have dedicated staff doing health equity work in the health department. We have tried to tackle it as a team. We try to all do what we can to address health equity, but we do not have dedicated FTE. For our chronic disease prevention programs, we do have staff that focus on tobacco prevention and cancer control. And we do our very best with some of our coalition work to address other chronic disease, but we don't have adequate staffing to address chronic disease. We know based on, so if you go back to our community health assessment from 1920 something, that assessment would have said communicable disease are your greatest threats to the people who live in your county. Today, our community health assessment says that chronic disease are the greatest threats to the people who live in our county. So it's heart disease, it's lung disease, it's cancer, and we don't have adequate staffing to really meet the need and do that work. And so we take the foundational area seriously. We assess to see how we do, and then we work towards trying to increase our capacity. But it really comes down to budget, and do we have adequate budget to do the work? And oftentimes it's bringing more grant funds in, and so because we don't have, we've had this conversation kind of over and over, but the tax base that we have in the health department is not enough to do all of the work that we need to do. So it's grants that we bring in to help us kind of fortify. 46% of the revenue that we bring into the health department are grants. So only 27% is tax revenue. So we do the work and we meet the minimum standards, but it's a challenge. And in some cases, we are not meeting the requirements. So, but those are our 10 essential services and our foundational areas, as well as our capabilities. So there is your Board of Health training for the month.
Thank you. There's a lot going on.
Yeah.
Yes. And I think I guess a good message to kind of wrap it up on is that these are national standards. So we don't make it up here in Lewis and Clark. At the health department, we prioritize and we do our work based on what national standards say we should be doing. So.
Well, until we get a sales tax, I think there'll be, problems, because this is not the only department that would like to have more money so they could do other things. And it's, well, like every one of our personal household budgets. Boy, I think we could squeeze a little in and I could have a trip to Hawaii. Or maybe I should just have a little for tools or tires for my car. That's the way we live. None of us have enough to splurge. We get by with what we've got. And
which is why I started with these are good. This is how we should. This is a tool that we use to make decisions.
Sure.
So when we only have so much money, we make sure that this is the work that gets done, is the work that we outlined today. But it's also a lot of work that is required, that we're obligated to do by law. So that's where the challenge comes. How do we do what we're obligated to do when there is only so much money?
And that is the way it is in every department.
Can I answer any questions? I tried really hard to make that fast, but it wasn't fast.
Well, it was
good.
It was good.
It was good. You said really things that needed to be said. I thought it was good.
Okay. I'd like to welcome any public comment on matters not mentioned above today. Mary Ann Denwell, please.
Hello, good afternoon, friends, public health friends. I'm Mary Ann Dunwell. I'm a state senator for Helena and East Helena, and I track all the good work you've done. I mean, I could go on and on and on giving Health Officer Neiman and your staff shout outs and the Board of Health. You do more with less and less and less. And as a state senator, I, for one, want to make sure you get some more. Take a look at those fees that you're going to ask for in the 25 session, that and more, I hope. So real quick here, I just want to give a shout out to Beth Norberg and her work at the East Helena site. You'd never know that was a Superfund site except for the slag pile, but that'll be gone soon and that'll be capped and covered. She has done extraordinary work with Bridget Williams, who's the EPA project manager, and a shout out to Mayor Harris, Kelly Harris, and Councilman Wes Weiss. They too have been very instrumental in making sure the residents who want their yards remediated and cleaned up can now get them cleaned up to the EPA updated lead levels. We have new science and we have new technology that shows that 1,000 parts per million that I remember existed when I started knocking doors in East Helena 10 years ago and talked to a woman who lived on Kalispell and she had kids and wondered why at 1,000 parts per million she couldn't get her yard cleaned up when no, I'm sorry. Yeah, 900 parts per million, 999, something like that. She couldn't get her yard cleaned up when her neighbor, who was at 1,000, got it cleaned up. Well, now they can, and we've seen lots of folks step up and say, yeah, I do want my yard remediated, for my current family and my kids, and for resale value in the event I want to downsize at some point. And we're seeing a lot of growth in East Helena, and I think this is just good all around for the community. So a shout out to them. And Health Officer Neiman, you mentioned SB 423, the Good Samaritan Safe Firearm Hold Act. Jess Hegstrom, your suicide prevention coordinator, gave her heart and soul. She put her heart and soul into working for that bill. I just want you and the board to know that. I know employees, public health employees, they're not the most well-paid folks. Probably could go to private industry and get some more, but I'll tell you how needed you are and appreciated. So I'm going to wrap it up since it's after 3 and with gratitude. Talk to you later.
Thanks for joining us.
Bye, senators.
Any other public comment? Okay. That we can adjourn. Thanks, everybody.
Thank you. If it was in